If you want to know what's going on in Rockingham County government, check out Rockingham County 411. If you're interested in county governmental programs, projects, and services, don't miss Rockingham County 411. Public Information Officer Mabel Scott will share important, crucial news you can use with Rockingham County 411.
Rockingham County 411, you're in a good place, and today we're going to be talking to someone who wears many hats. Justin Stewart is Rockingham County paramedic, medical examiner, training officer, infection control officer. Wow, how do you do it all?
It is a plate full, and then on top of that I have 6 daughters and a wonderful wife and a wide open schedule at home, so it's very interesting.
Yes. Tell us, we're going to talk today about opioids, and we want to narrow the scope and ask you, what is it like here in a rural community dealing with the opioids epidemic?
Well, you don't have everybody potted together in a small group. Mm-hmm. If you looked at our responses from the last couple of years, it's spread out, and then it would actually rotate around. Like at one time, Eden would be a hot spot, mm-hmm. and then Reeds will be a hot spot. Mm-hmm. And then the Stokesdale area has been a hot spot a couple of times, and it would always be spread out. So response plans were frustrating because you only have so much resources to dedicate to calls, and with the added opioid crisis, mm-hmm. it would increase that, and that would not just tie up one member of that response team, it would be multiple agencies tied up in that.
Boy, oh boy. And the whole idea of the Narcan.
Well, it has been a great tool,
yes,
to stop the deaths, mm-hmm. and that is one thing that I'm very proud of we've been able to do.
And that's important. So with Narcan, how many doses did we give to patients in 2019 between March 1st and August 5th? That time frame.
So we gave about 100. We gave exactly 111 doses of Narcan for a total of 74 patients.
Okay.
Which is still a lot if you compared it, because we have been keeping. Our commissioners really were supportive, and our county manager, to develop a report that way we could track. And since 2013, we've been tracking our Narcan usages and our suspected overdoses and our suspected deaths. It has been a good plan, because we unfortunately been having seen it watch it rise, particularly about 2014. It really took off, and then we have had some peaks, and then particularly this year has been up because I believe of COVID.
Yeah. So Narcan, just saving one life, that's important. One life, but we're saving more than that. Compare that with the numbers for this past year.
So we've doubled. So we're at 212 doses of Narcan and 143 patients. We've really doubled everything, and it's really understandable why. We live in uncertain times. Here,
people are under a lot of pressure.
Have you ever thought we'd be at a time that the whole economy was shut down, and people were pausing at home for 3 or 4 weeks at times, and just the mental stress from that happening? And if you have somebody who has a mental health problem, and then they have the addiction added into that, of course they're going to use more, and it's going to be greater, because it's just hard times for everybody. And realistically, a drug addiction is truly a mental health issue, and they truly have just like somebody who has hypertension or asthma or diabetes, it's something we need to treat.
Mm-hmm. It's a challenge.
It is a challenge, because in my time I have reached out to the community, and I'm very thankful that I've got to meet former addicts that have become either peer support specialists or supporters for the Narcan distribution, and listening to him speak. It was one in particular. I was at a meeting and listened to him speak. It really got me, because he has lived in our area and other counties, but I was talking to him, and he said, I had overdosed 15 times where Narcan had to be deployed. 7 of those times I was told I went into cardiac arrest. So, I've been in EMS for 29 years, I'm going to ask, why? why? And he was explaining to me the addiction drive. And he asked me, he said, do you have kids? I said, oh yeah, I have quite a few girls. And he said, when they're 2 years old, can you talk any common sense to them? I said, no, not really. If they want
up and down.
If they want a cookie, they want to do anything they can do to get that cookie.
You're right.
And he said, well, really, it's just like that. He said, when you're in a addiction craving cycle, he said, you really are of the mindset of a 2-year-old. Things that people tell you and distill to you don't make sense. And he said, it took me 15 times going through this. And he said, I think you were there before you treated me. And I don't know if that's true or not, but I mean, that's what he was saying. And I was pretty shocked by his statement, because I always worry about responder fatigue. When you respond to so many overdoses over such a period of time, after a while, that is a concern. But to hear his story 15 times, and
it was worth it all.
It is worth it all, because he's been free for 2 years. He's now a peer support specialist to stop people with addictions. And it was very impactful. And I'm very happy I got to hear his story. And 15 times seems like a lot, but I'm sure there's more people out there saying worse.
And until you walk in someone else's moccasins, you really don't know.
No, you don't know. And you don't know what they've been through, what childhood trauma.
Yes.
I mean, we're seeing a lot of childhood trauma. We're seeing a lot of developmental trauma. We're seeing a lot of abuse, sexual abuse, things like that.
Yeah.
And that's just the earmarks of what turns somebody into an addict, or poor mental health care, where they're using their addiction to try to be normal.
And with COVID-19 and how it has just ravaged all of our communities, and you think about the basics that you just always have had: food, clothing, shelter, your job, and so many of those strong foundational things just disappearing. It's difficult.
It is. I mean, would you ever imagine we would have a toilet paper shortage? I mean, how many weeks did we go to the grocery store and there was no toilet paper? I mean, well over 5 weeks. And
being at the place where you couldn't go to your church. This is something this is what America is all about, that you're able to choose and to go when you want to.
And still, we see the churches today are still not fully recovered.
Yes.
They're still not able to meet like they traditionally were. And you can think, now you multiply that onto somebody who is an addict, who their blanket for safety is that craving, that addiction to use. And with how cheap heroin, and it's not heroin so much. When I look at the toxicology records as a medical examiner, a lot of it's fentanyl, which is an opioid. But a lot of it now is transition to fentanyl, and it's a new synthetic fentanyl coming from other places in Asia, and we're seeing that come across. And every time we get the formula banned and say, hey, you can't do this, they modify it to bring it to the country another way. So it's very frustrating. And, our numbers are up. Yes, our numbers are up. But
we're saving lives.
I am very happy to say that. So, we're looking at a few years ago, we were at 25 deaths, and before that, even more. But when you can see that curve dropping off for deaths, when the Narcan distribution, the county commissioners, the county manager, our mental health partners, Department of Health and Human Services, DSS, our integrated healthcare team, and then come into that law enforcement buying in, and our first responders, and now pretty much everyone in the law enforcement field, we've trained how to deploy their kits.
And that training it's been a super answer.
It has been very taxing. It has been a lot of work. I'm very thankful for our partners in our rescue squads and our fire departments and our law enforcement partners for being part of this. And even our probation officers and our correctional officers have been involved in this. And it's just the response of them, I would have never dreamed there would have been so much for it. And I can tell you,
real collaboration.
And seeing the saves when they're getting there and they give the Narcan, and here's a person in cardiac arrest and they're deploying Narcan, and then we're getting pulses back and they're breathing again.
So in 2019, the Journal of the American Medical Association called Rockingham County an opioids high-risk county, but yet everything that you've said over the last few minutes has explained that yes, those numbers, they were up, but because of the training, because of the Narcan, we were able to save lives.
And it's not just us. It's the counties around us. It's other
Yes.
rural communities that are just being impacted. Anybody that have gone through a economic overturn, is what I like to call it, and changes, and then you put COVID in it, which impacts more jobs. It's common sense to realize those numbers are going to go up. But here's the thing: our death numbers are not up.
Yeah.
Right now, we're looking, and when I say that we believe that the death number is 9, that means until we get the toxicology reports and reports back from Raleigh to verify that information, and they publish that information,
Yeah.
we can't give you 100%, but we are right on top of since 2013. The numbers that we are been suggesting have been right on point, so well within the margins, and we're very happy to say that.
Some of the other initiatives, they're all just working together to support one goal.
It is, and so you now have your treatment facilities in the county that have been able to help us out and partner with us.
Thank God.
We have big props to the city of Reidsville, the chief of Reidsville PD itself have taken it on to start a PORT team, which is a post-opioid response team. So within 24 to 48 hours after someone passes away, or somebody is exposed or has a incident of being Narcaned for a suspected overdose, this team will reach out to them with peer support specialists, mental health specialists, and a law enforcement officer not dressed in traditional attire will be there as well, just to be supportive, not to arrest them, but to support them, because just like the gentleman had overdosed 15 times, we need to be there when that time that they're ready to get help, when they have that clarity and like, I need help. And if we can not miss that opportunity to provide that help, then maybe we can get more people off the drugs as well.
That's saying a lot.
It's I have the greatest respect for Reidsville PD for doing that. They just have really taken the chalice and just run with it right here, just trying to get it done. And Chief has done a great job. I'm proud of what he's doing. He's really, if you listen to him in our port meetings we're having, very passionate about it. He's brought a lot of the community resources into place, and it's a great place to start a project because they've had battles in the city of Reidsville with opioids just like anywhere else, and to see them reaching out to do that is pretty impressive.
We are our brother's keeper. We need to be there for each other, and we certainly thank you and all the folks who work with you for the hard work that you're doing and for being there when somebody really needs a friend. Thank you so much for being with us today.
Thank you for your time.
Justin Stewart, all part of Rockingham County, a good place to be.